This story is about alien students at a top medical academy, preparing for what they think will be a groundbreaking human surgery. But as events unfold, nothing matches their training, and the humans involved turn every expectation on its head. The Galactic Medical Academy shimmered with crystalline spires, each one humming with silent data transmissions as cadets of every conceivable species shuffled through the platinum walkways. A reverent hush usually blanketed the surgical wing, except today. Today, it was vibrating with the excited chatter of third-year xenomedicine students. "There's been a human injury," hissed Urinex, a lanky Kulvari with two sets of eyes, each blinking independently as he adjusted his sterile visor. "During zero-grav combat training, arm trauma." A dozen heads swiveled. Human injuries were rare. Humans themselves were rare in the academy. They were unpredictable, overly physical, borderline impossible to medically categorize without 10 caveats, and for those very reasons, utterly fascinating. "Which one was it?" buzzed Gryrax, whose gelatinous form pulsed a shade deeper green with curiosity. "Cadet Jackson, the tall one who drinks boiled bean water and lifts maintenance drones recreationally," Urinex replied, handing out sterilized pads and reviewing his notes on human musculature. "He was struck mid-spin, fell against the module wall. Witness said he didn't get up for several seconds. Gasping from 6 different lungs rippled through the room. Not getting up immediately was practically an emergency signal in human terms." The surgical lab lit up as bots unfurled trays of microscalpels and synaptic threaders. Antiseptic lasers warmed to life with a low hum. Students donned gloves and gowns, some running over translations of pain indicators in English, though most doubted they'd ever hear them. Humans, after all, were notorious for downplaying injuries to levels bordering on denial. "Prepare for full neural imaging and tendon mapping," ordered Dr. Rexel, the supervising physician, a towering Avexian with wings so vast they bent the lights when he turned. "If the deltoid is compromised, we'll reconstruct from the posterior chain." He stopped mid-sentence. One of the students near the entrance let out a sharp, clicking exclamation, then remembered and translated aloud. "Sir, there's someone in the pre-op bay, already operating." Dr. Rexel's brow ridges rose. "Impossible. We haven't brought Cadet Jackson in yet." Curiosity now boiling into alarm, the students abandoned their charts and swarmed toward the viewing pane. Inside, a man sat on the edge of the exam bed, shirt off, right forearm split open in a shallow laceration maybe 3 inches long. His elbow flexed rhythmically as he threaded a needle from what looked suspiciously like a standard-issue ration pack sewing kit. Calmly, precisely, he guided the curved point through skin, pulling taut with each stitch. No antiseptic spray, no numbing field, just bottled water and stubborn resolve. That's him, right?" whispered Urinex, his eyes twitching as he reviewed the cadet log. "It has to be. The jaw structure matches." Dr. Rexel stared, not quite blinking. Did he requisition clearance to self-perform surgery? "No," someone muttered. Silence returned as every alien in the room stared, trying to reconcile what they were seeing with what they'd been taught. Threads tugged. Skin closed. The human tightened a knot with his teeth. "That's a high-function trauma response," muttered Gryrax. "No tremors, no visible distress. Is that cultural conditioning?" They watched him rinse the stitched arm with water, then tape a gauze pad over it, the movements brisk but not hurried. The man stood up, rotated his shoulder a bit, then walked toward the exam room's outer door, cradling the arm loosely but with no overt sign of suffering. "What kind of pain tolerance is that?" whispered a small voice. Before Dr. Rexel could formulate a theory, the outer door hissed open again and another human stumbled in, breath ragged, left arm hanging at an odd angle. This man looked absolutely wrecked. Sweat streaked across his forehead, his jaw clenched so tightly it might snap, and his left hand fluttered weakly near his shoulder, not quite able to touch it. "I think it's out," he grunted. A beat of silence. Then all 20 alien students recoiled in perfect synchrony. "Another one?" Gryax squealed. Dr. Rexel turned so fast his wing cracked against a light fixture. "Who are you?" The second human, taller, broader, definitely not the same person, grimaced. "Cadet Jackson. Took a bad spin into the wall during training. My shoulder's out." A silence fell like a curtain. Slowly, all eyes drifted back to the exam bed. The first man was now drinking from a water pouch and poking experimentally at his stitched forearm. "If you're Jackson," Yernek said carefully, "then who is that?" "No idea. That's Nick. My bunkmate. Think he came to check on me." Nick raised his good arm and waved, still inspecting his self-done stitching. "Heard you ate it during drills. Came looking. Cut myself on a sharp edge getting through maintenance cross space. Didn't want to bother anyone." A noise somewhere between a groan and a mechanical reboot filled the surgical theater. Dr. Rexel looked like his feathers might combust. The real patient Jackson still winced, cradling his dangling left arm. "Can someone just pop it back in?" 20 students looked at each other. No one moved. "Pop it," one whispered. Dr. Rexel cleared his throat. "I assumed this would require at least mild reconstructive support. The angle suggests possible damage to the supraspinatus. We'll need imaging to determine whether nerve regeneration—" No, just dislocated. Done it before. You just gotta brace it and give it a good shove. Hurts like hell, but it works," Jackson said through gritted teeth. The aliens froze. Nerve mapping lasers paused mid-cycle. "You want us to shove your arm back into place?" "Please," Jackson rasped, leaning against the frame for support. Yernex turned to Dr. Rexel. "We've never done shoving." The doctor's eyes narrowed. "It's not in any of our human surgical modules." "No offense," Nick called from the corner, "but if you all start pulling out nerve saws, I'm taking them to the cafeteria and doing it myself against a table corner." Jackson groaned, half laughing, half dying. "Please, let's just do it, before I pass out, or one of you disassembles my shoulder for study." Dr. Rexel made a strangled sound in the back of his throat. Yernik slowly raised a shaking hand. "I volunteer to perform the shove." Yernik stood frozen, gloved hand still raised, regretting every life choice that had led to this moment. Dr. Rexel nodded solemnly. "Very well. Yernik, perform the," he hesitated, "shove, but record everything. This may be the only human intervention of its kind on record." A flurry of recording drones zipped overhead, forming a semicircle around Jackson, who had now seated himself on a metal stool and was breathing through his nose like he was prepping for a sprint. Yernek stepped forward, hands trembling. "Could you possibly provide more specific instruction on where to grasp and which direction to apply force?" Jackson clenched his jaw. "Grab the wrist and elbow. You'll want to lift slightly, then rotate and push inward. It's all about angle, smooth motion, not too fast." Nick chimed in from his corner. "If you hear a loud pop and he screams, congrats, you did it right." Several students reeled back. One actually dropped a scalpel. "Understood," Yernex whispered, trying to position himself without making eye contact. His forefingers pressed gently against Jackson's elbow, and two more gripped his wrist. The human's arm was hot, muscles twitching under the strain, but no blood, no open fracture, just a joint in the wrong place. "Brace yourself," Yernex muttered, more to himself. "I've been braced since I walked in," Jackson hissed. Yernex inhaled through his dorsal spiracles, lifted, rotated, and shoved. There was a sickening clunk pop, followed by Jackson's half-yell, half-growl that rattled the wall panels. Yernex recoiled so hard he nearly tripped. "Did it work?" Greyex asked, voice trembling. Jackson sat hunched for a second, hand pressed to his shoulder, breathing like a man who had just sprinted through fire. Then slowly, with a grimace, he rotated his arm forward, then back. "Yeah," he said hoarsely. "That's in." "Dear stars," muttered a student near the back. "We shoved a human back together." Dr. Rexel stepped forward. "You should still undergo imaging. Confirm the capsule and ligaments were not compromised." "Yeah, probably," Jackson said, wiping sweat off his brow. "But it's back. That's the main part." A wave of whispered awe passed through the room. Nick stood and approached his bunkmate. "You good?" "Will be," Jackson nodded. "You okay?" Nick raised his bandaged arm. "Yeah. I stitched it closed, but I should probably disinfect it more properly. I didn't even have isopropyl." Dr. Rexel stared at him. "You performed unassisted tissue closure with non-sterile materials." Nick shrugged. "Well, it was sterile when I got the kit. I don't eat with it." Urnex, still trembling, sat down abruptly on a diagnostic console. "Do all humans self-suture when medical care is unavailable?" Nick looked puzzled. "Is that not normal?" "No," answered 3 students in unison. Gryrax floated closer. "You didn't feel the need for pain suppression? No sedatives?" Nick said, "it hurt a lot. But there were only 2 inches to close. If it were any deeper, I'd have waited for a medic." Dr. Rexel interjected. "You punctured your dermis, stitched the wound, and then navigated a Class 2 maintenance corridor to locate your injured bunkmate, all with no immobilization." "Well," Nick said, rubbing the back of his neck, "I wasn't going to just sit around." "Your pain signals must be delayed by some neural filtering system," muttered a Nuvaxi cadet, tapping furiously into her tablet. "No, I just screamed internally," Nick replied. Dr. Rexel motioned both humans to follow him into the recovery wing. "Regardless, both of you must undergo full diagnostics. We must ensure your joints, tissues, and immune systems remain stable. This level of trauma tolerance is unsettling." Urnex rose shakily. "Do I list this as a successful procedure?" Dr. Rexel stopped in the doorway, listed as unexpected human response to traumatic dislocation, resolved via informal musculoskeletal realignment. Also, annotate, human supervision mandatory. As the humans were escorted away, the students trickled back into the surgical lab, silent, dazed. Gryrax finally asked, "Should we continue with the simulation lab?" No one answered. Instead, they all drifted toward their consoles and began feverishly rewriting everything they thought they knew about human physiology. 2 hours later, Jackson sat in a diagnostics chair, his arm in a cold compression wrap. He looked exhausted, but stable. Nick lounged nearby, sipping water. "You okay?" Jackson asked. Nick held up his forearm. "Still throbs. Probably could have let them do it properly, but honestly, I've had worse." Dr. Rexel was poring over their scans on a holo display. "Your shoulder has minor strain in the rotator cuff, but the humeral head is properly seated. There is no fracture. We'll prescribe a 6-week rehab with mobility constraints." Jackson nodded. "That's about what I expected. Your friend's forearm wound is surprisingly clean, though we'll re-sanitize and redress it," the doctor added. Nick grinned. "Thanks. Maybe this time with actual antiseptic." Dr. Rexel hesitated. "There's one more thing. The surgical trainees requested you address them. They believe they've just witnessed an important cultural event." Jackson raised an eyebrow. "They want me to what?" "They want to understand what compels humans to treat serious injuries with improvised methods, to act independently of formal medical structures, to shove one another." Nick snorted. "We're not trying to confuse anyone, we just solve things fast, especially when it hurts." Dr. Rexel turned. "They believe it represents bravery, defiance of pain, evolutionary hardening. Some are calling it tactical suffering." Jackson and Nick stared at each other. "I think we just made a lot of homework for them," Jackson muttered. Nick nodded. "Let's go talk to them before they start writing poetry about dislocations." The briefing hall was packed. Holo recorders hovered in tight formations above the semicircle of alien cadets, each shimmering with academic enthusiasm, notepads open, data feeds pulsing with annotated theories. Words like voluntary threshold suppression and selective triage autonomy flashed across dozens of personal interfaces. Nick leaned toward Jackson as they stood outside the sliding doors. "They're calling this a live behavioral deviation symposium. You think we're about to get grilled? Jackson shrugged carefully. They watched you stitch your own arm shut with a food kit. I think they want answers. The doors slid open. They stepped into the amphitheater to scattered chirps, buzzes, and applause that varied wildly, depending on the appendages clapping. Dr. Rexel stood center stage. Cadets, these are Cadets Jackson and Nicholas. Today we explore the psychological, physiological, and cultural aspects behind their medical responses. Jackson muttered under his breath, I swear, we just got hurt. Nick gestured vaguely. Let's sit. Try not to lift anything. You're technically broken. Dr. Rexel motioned them to the front bench. Let's begin. Cadet Nicholas, what prompted you to bypass the emergency alert system and perform autonomous wound closure? Nick scratched his neck. Honestly, I didn't think it was bad enough to hit the panic button. It bled, sure, but I've cut myself before. Figured I'd patch it and check on Jackson. A flurry of whispers erupted. Prior experience? Asked a wiry Kazanari, fingers fluttering over her tablet. Was this part of formal human training? No, Nick replied. I helped my uncle on a ranch back home. Barbed wire, animal scratches, that sort of thing. You learn quick when the nearest clinic's a 2-hour drive. Fascinating, Dr. Rexel murmured. So injury normalization is common in low-infrastructure environments. Jackson added, a lot of us grow up with some kind of just deal with it mindset. It doesn't mean we like pain, we just learn to keep going through it. Another student raised a hand. Cadet Jackson, why did you reject standard surgical preparation for your dislocation? Jackson smirked, then winced at the pull on his shoulder. You've never had something out of place before. It's like every nerve screaming, and the longer you wait, the worse it gets. The moment you know what's wrong, all you want is to fix it. Gryax waved a tentacle excitedly. But you knew it would hurt more to fix it. Yeah, Jackson said. It did. Still does. But you asked us to do it anyway. No sedation. No numbing. Would have taken too long, Jackson replied. I needed my arm back. Waiting made no sense. The silence stretched. Your neck stood slowly, clearing his throat. We had a 46-step protocol ready. Multiple nerve stabilization nodes, cortical sedatives, regenerative mapping. Nick held up a hand. Let me stop you there. That's all great, and I'd be thrilled if someone used that when I'm unconscious on a stretcher, but I was conscious. Jackson, too. We both knew what had to happen. That changes things. But how do you function with that level of pain? Someone blurted. Jackson looked thoughtful. Pain's not always the enemy. Sometimes it's just part of what happens. If you wait to be comfortable, you'll never get anything done. Nick leaned forward. And it's not bravery, it's habit. You fall, you bleed, you tape it shut. You deal with it. Humans aren't tougher than you, we're just stubborn. The murmuring picked up again, this time filled with awe. A massive tricorn in the back raised a heavy arm. Do your species encourage this as a rite of passage? Jackson laughed. No. Our species usually tells us not to be stupid. Nick added, we just don't always listen. Dr. Rexel turned to his students. You've observed two distinct reactions to injury. Self-managed triage with improvised tools and expedited joint relocation under duress. What can we infer? Rearax floated up. That humans evaluate urgency independently. They operate with minimal hesitation once diagnosis is clear. Urnex nodded. And they prioritize function over form. If the arm moves again, they accept pain as an acceptable cost. Correct, Rexel said. But most critical is this. Humans do not treat trauma as sacred. They treat it as a problem to solve. Now, imagine the implications for battlefield medicine. The entire hall erupted in frantic data tagging. Jackson leaned back, exhaling slowly. We just became study material. Nick bumped his shoulder gently. Look at the bright side. We'll ace our behavioral psychology module. Jackson snorted. Assuming they don't start asking us to demonstrate it again? Gryrax drifted closer, shy but determined. Cadet Nicholas, may I request a simulation interview for my thesis on self-suturing psychology? Nick blinked. Sure, but I get to keep my shirt on this time. Gurak's eyes widened. That is, negotiable. Dr. Rexel tapped his tablet. We'll schedule follow-ups. For now, I want both of you off your feet. Jackson, your shoulder ligaments must rest. Nicholas, we'll recheck your wound for infection markers. As the humans stood to leave, a small cheer rose from the cadets. Jackson muttered, "It's surreal getting applause for falling on my face and screaming." Nick gave him a sideways grin. "Hey, you made shoving educational." Outside the hall, as they limped toward the medical bay together, the door shut behind them and muted the rising tide of hypotheses about human behavior. Inside, Yernex remained standing. "Sir," he asked slowly, "if humans normalize trauma, how do we teach others to treat them safely?" Dr. Rexil tapped the side of his console, bringing up the human physiology files. "We don't normalize it, we respect it, and we prepare better questions next time." The recovery bay was dim and quiet, the steady thrum of equipment humming beneath the low lighting. Jackson lay stretched out on a flat recliner, his left arm elevated in a sling, his shoulder wrapped in a supportive brace cooled by a regulated gel. He had accepted the full 6-week recovery protocol, if only because Dr. Rexel had personally threatened to notify Earth's interspecies training coordinator if he didn't. Nick sat nearby, propped up against a diagnostic pod, a sterile bandage covering his stitched forearm, which had been properly disinfected, re-stitched, and coated with dermal sealant. Despite being the less injured of the two, he looked equally worn. The door slid open, and Yernex entered with a cautious step, followed by Grirax and 2 other cadets. Each carried a datapad or analysis scroll. "Is this a bad time?" Yernex asked, already halfway through the doorway. "Nope," Nick said, motioning to the extra seats. "Come in. We're just resting and trying not to sneeze too hard." "We've compiled additional questions," Grirax said, eyes bright. "No more about self-stitching, I promise. This is more cultural." Jackson chuckled. "You guys know I dislocated my shoulder, not wrote a book." "Yes," Yernex said, settling into a chair. "But the implications are extensive. We've updated our training modules. Some cadets are even creating mock trauma drills based on your behavior." Nick raised an eyebrow. "You mean they're pretending to get hurt just to see how humans would act?" "Not exactly. They're simulating human priority protocols, what your species deems urgent or negligible. We've discovered that you often treat pain as secondary to goals." Which, Grirax added, challenges the premise that pain avoidance is a universal behavioral driver. That alone contradicts 5 centuries of exobiological assumption. Jackson blinked. "So by getting wrecked and refusing surgery, we broke science?" Yernex made a sheepish gesture. "Adjusted it, slightly." Nick laughed. "That's so us." They all sat in silence for a moment, the steady pulse of a bioscanner ticking in the background. Jackson leaned forward slightly, wincing. "You know, we're not trying to show off. Most of the time, we just don't want to waste anyone's time. If we think something isn't serious enough, we try to handle it. Sometimes we're wrong." Grirax tilted his head. "You would accept permanent damage rather than inconvenience others?" Jackson sighed. "It's not about damage, it's about time, resources. Not making a scene." Nick nodded. "And sometimes it's habit. Where we come from, you patch yourself up so you don't slow the group down. Doesn't mean it's smart, just what we're used to." Yernex looked thoughtful. "But you understand the risk." "We always do," Jackson said quietly. There was a pause. Grirax shifted uncomfortably. "So what happens when a human can't fix it themselves?" Jackson looked up, eyes serious. "Then we ask for help, but by then, it's usually bad." Nick added, "We're stubborn, not invincible. That's why you learning this stuff matters." Yernex nodded slowly. "You've taught us more than we expected. Not just about physiology, but psychology, resilience, bias. Your responses defy so many of our metrics." Drax smiled faintly. You made medicine confusing, in a good way. The two humans shared a look. Jackson grinned. Glad to be of service. Nick added, next time, maybe one of you pulls a muscle and we get to panic for a change. The aliens laughed, an odd chorus of chirps, bubbles, and a gentle hum from Yernek. After a while they stood, offering a respectful nod. We'll let you rest, Yernek said, pausing at the doorway. But, one more thing. He held out a thin datapad, its screen displaying a freshly approved entry in the Galactic Medical Reference Database. Entry: Human Musculoskeletal Trauma Response Patterns. Field Adaptations. You're listed as case examples, both of you. Jackson took the pad and stared at the screen. Huh, we're textbook now. Guess we'll be on an exam someday, Nick muttered. Urinek smiled. You already are. The practical portion includes mock dislocations. They laughed, to a round of quiet laughter. As the door closed again, Jackson leaned back, his brace softly hissing with cooling air. I gotta admit, he said, eyes half-lidded, this is a weird legacy. Nick folded his arms carefully. Could be worse. We could have ended up as a cautionary tale instead. Jackson chuckled. Give it a week, we still might. They sat in peaceful silence for a while, the hum of machines lulling them into rest. And far across the training complex, in Lab C7, 20 alien cadets practiced simulated shoulder realignments on a human-shaped mannequin, while arguing over whether a grunt or a growl was the appropriate cue for successful reseating. Human medicine had changed the galaxy not by surgical technique, not by advanced tools, but by sitting on a stool, gritting their teeth, and telling a room full of alien surgeons, just pop it back in.